And go ahead and start your watch parties and tag and share. This is going to be a 2 day seminar. I'm so excited and I'm so honored that Brandi would even accept the challenge for us to come and try to carefully inform people regarding this subject. Good evening, Katrina. Good evening. Amen. And so, what I'm going to do right now is I do have a biography of Miss Brandy, but I'm just giving a few more people the opportunity to tag and share. Brandy has a large family. I pray that Tina, you would tag some of your family members. I'm just listen. Uh, Hi, Victoria. Hey, Mr. Johnny, thank you so much. I want to say this. I want to put this out there. I've known Brandy since she was a little girl. Brandy's mom and I were best friends for over 40 years. Uh, so I've known Brandy ever since she was a little girl, and I've watched her, evolve through a young lady and now a woman doing the things that she's doing to help our communities. And if we would be honest, we need all of the help that we can get within the community and speaking to people that will speak to us regarding some of the major concerns that we're living with in our society and that we have within our families, within our own family. Hey, Netta, thank you for joining. Johnny say he tuned in for a good nugget. You gonna get one too. Okay, so I'm not gonna prolong it anymore. I'm gonna go ahead and I'm going to introduce Miss Brandy, her introduction, and the next voice that you will hear will be that of Miss Brandy Roberts. Okay, now I'm gonna put my introduction in there before I get to her introduction, and my introduction is she's a native of Palaca, Florida. Her mother is named Tina Passmore, born to Tina Passmore and Freddie Roberts. They're both my classmates. And she has a younger brother and a younger sister. She is the oldest of three. Okay, so that's my personal introduction that I know of Miss Brandy. She's born to Tina Roberts and Tina Passmore. Please forgive me, Tina Passmore and Mr. Freddie Roberts. Okay, and so besides that, Brandy Roberts. She earned a Bachelor of Science in Health Education from the University of Florida. And after the completion of her undergraduate studies, Brandy accepted the Public Health Associate Program Fellowship with Centers for Disease Control and Prevention in the focus areas of HIV and STD prevention and emergency preparedness. She continued to further her knowledge and academics into earning a Master's of Public Health professional degree from the University of Arkansas for Medical Sciences. She is affiliated with various civic and professional organizations such as the Arkansas Society for Public Health Education, Public Health Associate Program, Alumni Association, current president of the Arkansas Public Health Association, and is a board member for the National Coalition of STD Directors. Brandy's current role is the STD Prevention Program Manager for the Arkansas Department of Health. And what Brandy did not share with you, she's a graduate of Florida the University of Florida. She is the orange and blue, y'all. She's a Gator fan, and she's the graduate from Florida. Of University of Florida and going on matriculating to a higher level of education in Arkansas. I couldn't leave that out because she's an Arkansas resident, but she's a native of Florida. She's a Florida Gator. For all of you Florida Gator fans, y'all go tag some of the Florida Gator fans. Y'all go tag some of them and let them let them come on in. Listen, I believe in laughing. I believe in laughter, and I'm laughing because the information that's going to be presented is going to be kind of tough. It's going to be tough information, but it is information that we need. It's very necessary for the time and the dispensation of what we're living in. I think part of the problem in the church and out of the church is that we fail to discuss some pertinent information that will prevent people from making a lot of mistakes or remaining in some things that sometimes can lead them to a place of even death. Y'all not hearing me today. And so I may be criticized and I may be scrutinized for what we're about to talk about, but it is a conversation that is truly necessary. So the next, oh, Gator Mom, go Gators, go Gators. So the next voice that you will hear will be that of Miss Brandi Roberts. Amen. Brandi, can you please, I'm going to mute myself for the moment, but can you please tell us your position and what
Okay.
you at the health department in Arkansas?
All right, sure. Can y'all hear me okay? All right, well, good evening, everybody. And thank you so much, Chiquita, for allowing me the opportunity to get on here and talk about, as you mentioned, something that I am very passionate about. It's so funny. My sister asked me, was I nervous today? And I'm like, no, I'm not nervous. Nah, bro, I'm not nervous because this is something that I talk about every day. This is something that, I live, breathe, and eat every day. As far as, my current job, as far as the work that I do in the community here in Arkansas. And then also, like my family can tell you, I bring condoms home because they know that this is very important to me to be able to spread this information to others, especially, to those in my hometown that is not only affected by this, but infected by, this public health issue that nobody wants to talk about. And then also, before I get started, I want to go ahead and acknowledge my other siblings that Mr. Keita did not mention, because I know they will probably kill me if I don't say anything about them. So my older brother, Freddie Roberts, who is a Florida State fan. And then also my younger brother, Fred, who's actually graduating from high school this year. So definitely proud of him. So definitely with this presentation, it's going to be real. It's going to be straightforward because I am definitely not a person for sugarcoating. Mr. Keita gave me the rings to talk and I'm going to talk. Okay, so this is, like I say, this is not a formal presentation. I am going to give you information. Feel free to ask me any questions that you may have. Okay, I talk about sex every single day. I talk about sex to old people. I talk about sex to young people. I talk about sex to your mama, your daddy, whoever. So this is something that I'm very comfortable with. And again, no question is a bad question. And like I say, ask me any question that you may have, because if you don't ask, you ain't gonna never find out. All right, so I do have a presentation that I'm going to share. All right. Okay. Can y'all see the presentation? All right. All right. So let's talk about sex. I was up here trying to figure out what the title of this presentation was going to be. And I was like, you know what? Let's just talk about sex, because that's pretty much what we're talking about today. And in recognition of Public Health Week, and this actually is Public Health Week. And then also next week is Sex Week. That's actually from the CDC. So let's talk about sex. All right. All right, so let's just start off with the basics. What is an STI? All right, so a STI is a sexually transmitted infection, also known as an STD. We use the word interchangeably, but for practical purposes, I'm going to say STI because that's the technical term that we're going to use, but it's the same thing as an STD. Whatever you want to call it, it is what it is. So a sexually transmitted infection is used to refer to a condition that is passed to one person to another through sexual contact. Okay. And the other thing to note, that the only way a person can contract an STI is by having sex with someone who has an STI. All right. So that person has to have this STI or this infection in order for you to get a STI. And depending on the specific STI, some infections can be passed through sharing needles and breastfeeding. So I'll get into that later on, because like I mentioned, most of them are through sexual contact, but there are some STIs that can get passed through sharing needles and also through breastfeeding of your baby. So this is the only slide in which I'm going to show data. I'm not a huge fan of data. I know data is important. I know data is what drives interventions, but to me, as we know, data is only as good as what's reported. Okay, so if this information isn't reported, it isn't going to reflect that. A lot of data like to show that a lot of African Americans are impacted by these diseases and fail to show that other people are impacted by these diseases, but STIs, they affect everybody. So it's not important to me to show you some stats when it don't matter, when this is an illness that can affect anybody. So again, this is gonna be your only slide that you have today that's gonna give you some information as far as the magnitude and the impact of STIs and what it has on individuals in the United States. So 1 in 5 people in the persons in the United States have an STI. This information is from 2018. The 2019 data has not been released yet. Of course, due to COVID, a lot of that information is delayed, but just know the numbers are increasing. Even here in Arkansas right now in 2021, we are having a syphilis outbreak. So we all expected people to stop having sex during COVID, but they didn't. You know, as I say, it's kind of funny how we having an STI outbreak in the midst of a pandemic in which we supposed to be social distancing. How did that happen? But it did. And I'm sure, you know, in Florida and actually across the United States, we all are seeing the same increase in syphilis and other STIs. So most of your STIs are going to affect your young people 15 to 24. So when we talk about gonorrhea, chlamydia, it's going to infect most of your younger folks. And again, we're going to get into that of why that, you know, STDs are most commonly in our younger individuals. And of course, you know, we got to talk numbers. So STIs contribute to almost $16 billion in direct medical costs. Okay, so when you get into HIV, the medication for HIV is very expensive. Antibiotics for all these individuals that have STDs, penicillin, things of that sort. So it is a large impact, even though, you know, most insurances pay for it and the health department covers the cost of a lot of these costs, but it does cost a lot to treat STIs. And then also when you think about the indirect medical cost that comes with that, you know, for individuals that may get PID, you know, individuals that, you know, become infertile and now can have children, there's a lot of impacts that come from STI. And it's so crazy that this is preventable. All STIs are preventable. So why is this important? Why am I even on here running my mouth about something? So the first thing is most of your STIs have no signs or symptoms. Okay, you know, like I like to tell my kids, you cannot look at somebody and tell that they have an STI. You cannot look at somebody and tell that they have HIV. Okay, so that's the first thing, you know, that I wanted to note, that most of them don't have any signs or symptoms. The second thing is people are unaware of the infection, and what that means, they don't go and seek any type of treatment. Okay, so you have folks running around here with STIs, not going to get tested, which means that they're not going to receive treatment, which means that this is going to continue to spread. Okay. STIs can cause long-term damage. Okay. So as I mentioned before, chlamydia especially, gonorrhea especially, a lot of women who have these infections and don't get treated, this can cause you to not be able to have children later on in life. Okay, so you may think it's something that's, you know, oh, I can just go get an antibiotic for it. Oh, I'm not worried about this. Oh, I'm not going to use condoms. Oh, I'm not going to do this. But if you plan on having children, you definitely want to, take this as something that can be lifelong consequence for you choosing to not use condoms, or you're choosing to not go get tested, or you're choosing, to not know the benefits of, going to get tested and get your partner tested and so forth. And then fourthly, you may have passed this infection on to others. Okay, so if you don't go get tested, you know, they got this big thing where they say know your status. If you don't go get tested, you don't know what you have. All right, I know a lot of people don't want to go get tested because, oh, I don't want to find out, or this and that. You know, if you don't if you don't go get tested, you're not gonna know if you have anything. So it's very important, you know, that everyone go get tested for STIs. So who needs to be concerned? You, okay? Because again, like I say, STIs infect everybody. It impacts everybody. Even if you're not having sex, you have other individuals around you that may be having sex. It can affect your kids. It can affect your mama. It can affect your grandma. Even your grandmas are around here getting STIs. They do. So yeah, so that's why it's important, and that's why everybody needs to be concerned, because as a community, especially amongst our African American folks, we need to be concerned about things that are, like I say, taking the lives of our young adults, causing, you know, us not to be able to have children, and having these long-term effects on individuals of color. So I got a little thing because I like to have participation, and I just wanted to throw some questions out there. And the reason why I'm throwing these questions out there is because I hear this all the time. So one of the things that I want to go ahead and mention, you know, before I start these questions, you know, when I actually started my career in sexual health education, I was a disease intervention specialist. So as a disease intervention specialist, what I did and what my role was to contact individuals who are infected with STDs, okay, or STIs. When we contacted those individuals, we try to locate their partners, we try to make sure they get tested. You know, we try to educate those individuals on STIs. And you would not believe how many individuals that I run into, young and old, even with Google, that don't know simple information about STIs. Oh, I got it from the toilet seat. Oh, you know, my boyfriend say he had. Okay, if you got it, that means you got it from somebody. Okay. So just to go over these questions, and I don't know if we can talk or if you can put it in the chat or things of that sort, but just want to talk about, you know, just a few common myths about STIs. So the first thing, women are more likely to get tested for STIs. Myth or fact? All right, so that is a fact. Okay, and not that I'm trying to throw any shade on our guys here, but we already know women are more likely to go to the doctors than men, okay, because we are taught younger to have our pap smears, to go get checked. You know, we have babies, so we have to get tested, you know, when we have babies and things of that sort. And y'all always know you always have to drag these guys to the doctor. They only go when something hurting, or, you know, when something about to fall off. So it is true that women are more likely to get tested for STI. And also because it is recommended in the, it's recommended that women get tested for gonorrhea and chlamydia, especially because of the long-term consequences that can come as a result of not getting tested for chlamydia and gonorrhea, and also not getting treatment for those typical infections. All right. The second thing that I have, myth or fact, and I actually touched on this one, so I kind of cheated a little bit. If my partner has an STI, I'll know or see it. Myth or fact? And that should be an easy one there. All right, and that is a myth. No, you cannot get somebody and tell that they have an STI. All right, I know some people say, oh, you know, they losing weight, or, you know, they look sick and all this other stuff that y'all know how folks are. No, you cannot look at somebody and tell that they have an STI. All right. Third, only gay and bisexual men get STIs. Myth or fact? Y'all already know this is a myth. No, I know that when HIV first came out, that was one of the things, oh, it's only a gay man's disease. Oh, it's so, only for these individuals who out doing this and no. Anybody who's sexually active can get an STI. STIs do not discriminate. All right. Only girls who are out there get STIs. So these hot girl summers, it's cuffing season. Only them girls who out there get STIs. Get the fact. All right. And y'all know it's a myth. I ain't gonna tell y'all how many married women that came across my desk with a STI. I'm not gonna tell you how many pastors that came across my desk with a STI. So this is just not for certain individuals. So don't think just because, you have one partner or you have 20 partners, that you are not gonna get an STI. Anybody can get an STI if they're sexually active. All right, my fifth one, and y'all know I had to throw this one in there. I'm married. I'm not at risk for getting an STI. Y'all know my husband ain't doing nothing. Y'all know my wife not doing anything. Y'all already know that. And then what's so interesting about this, just to kind of throw this little caveat in there about this, is that a lot of providers do not test individuals that are married. Of course, they don't want them saying, that they're stepping out and things of that sort. So if you are married, I definitely suggest that you get STIs. I don't care how much you trust your partner, because again, just this week, I done had individuals come across my desk that have a STI and they're good and married, 20 years married. Okay, so this is something that you have to ask for. So don't go in there and assume, they tested me for everything, that they test you for STIs. Make sure that you specifically ask them to test you for STDs, gonorrhea, chlamydia, syphilis, HIV, test you for everything. Your insurance is gonna pay for it. It's on you, you know what I'm saying? So make sure that you're asking for it, because they're not gonna automatically do this. And especially for individuals that's married. I've run across that a lot when I'm talking to providers. She was married, he was married. That's why we didn't test these individuals for STIs, and got a big old rash on their hands. We thought this was just something else because they married. What that mean because they married? It don't mean nothing at all. All right, so the next one. I'm in the church. I can't get an STI. I know I probably touched something there with these folks in the church, because I know y'all don't like to talk about sex in the church. It's interesting, because the two hardest populations, and like I said, I can speak for Arkansas because this is where I've done most of my work, but those are the two main places that we have the most trouble getting into, is the churches and the schools. Okay. And then my thing is, all these pregnant girls be sitting up here in the church, and then y'all acting like folks not having sex. What you mean? What you mean? Okay. So that is definitely a myth. Okay. And the last one I have is, you cannot get an STI if your partner is a virgin. That may be a tricky one. All right. And that is a myth. All right. Oral sex is considered as sex, whether y'all believe it or not. Oral sex is sex. You do not have to penetrate in order to get an STI. Okay, so don't just think because somebody is a virgin, you can't get no STI. Oral sex is sex. All right. All right. So just to do a basic overview of STIs. So the ones that we have that's curable, so meaning that there is medication for these, is chlamydia, gonorrhea, syphilis, trichomoniasis. There's a lot more STIs, but we're just going to talk about the main ones. And then the ones that we have that are incurable, and like I like to tell people, the ones that start with an H. Okay, so that's going to be HIV, herpes, HPV, and hepatitis B. Okay. All right, chlamydia and gonorrhea. And I just wanted to go over this information because as I mentioned, when I'm talking to individuals or trying to educate them on STIs, they say, oh, I didn't know I had it, or, I didn't know how it's passed, or how can I get it? Because like I said, you'll have these guys and women up there give people all these different stories about how they got something. Oh, you ain't get that from me. You probably got that from kissing on this boy down the street, or you probably got that from sitting on the toilet seat. You can't get no STI that way. All right, so for chlamydia and gonorrhea, these are your most common STIs. All right, so they are spread through vaginal, anal, or oral sex. Yes, I said it, oral sex. You can have gonorrhea in your throat. You can have chlamydia in your throat if you have oral sex on somebody who have these infections. Okay, so that's what I mentioned about the virgin. You can have these illnesses in your mouth. All right. Pregnant women can pass on these infections to her or to your baby during childbirth. Again, in most states, it is required that when you're pregnant that you receive testing in your first and third trimester. And this is why, because those illnesses can be passed along to your baby. Some of the symptoms of chlamydia and gonorrhea is an abnormal discharge. And I want to talk about that. Most women know their typical discharge. Okay, you're going to have a discharge because that's the body's way of cleaning out your vaginal area. What I mean by abnormal is different than your normal. Okay, so if you see some stuff that's green, that's yellow, it don't look right, it got a smell to it, you need to go get tested. Okay, pain for urination, that's going to be especially common in gonorrhea. Most of the guys, they tell me that when they have gonorrhea, feel like they pee in razor blades. All right, so if you have any type of pain for urination or it hurts when you pee, you need to go get tested. All right, when we go to anal sex or rectal, okay, so you can have rectal discharges, like I say, anywhere, any part of the body where you're using to participate in sexual activity, that's where you're going to tend to have those signs and symptoms. So these are some of the things that you need to look out for: swollen testicles, and then bleeding. And then, as I mentioned, they can lead to infertility, not being able to get pregnant. For men, you not being able to get a woman pregnant. Okay, PID, which is a very serious disease for women that, again, that can cause that woman to be infertile. So, and this is mostly if you do not get treated for these infections. Okay, so again, that's why it's very important that you go get tested for STIs and that you try to reduce your risk as much as possible, because they can lead to some very, very deadly consequences. The next one that we have is syphilis. It's crazy because when I first started in STIs back in 2008 as a disease intervention specialist, we didn't think syphilis it was even existed. And I was like, people get syphilis, because that's like nothing that you hear people talk about. But it's so many people that have syphilis. Like it was just crazy. It was just the craziest thing. And then like even right now, we're having a syphilis outbreak where traditionally it's more in your gay men, men who have sex with men and your older individuals. But now we're starting to see syphilis in a lot of younger individuals. Okay, so with syphilis, syphilis is very interesting because syphilis goes through a couple of different stages. So you have primary syphilis, you have secondary syphilis, and then you have latent syphilis, which is syphilis, that you've had for a period of time. With syphilis, first of all, you'll get a lesion. Okay, it's like going to be around. It don't hurt. Most of the time, the doctors will say that, oh, this is a zipper cut, or, a guy might think this is like a zipper cut. Sometimes they get confused with herpes. Sometimes they get confused with genital warts. So that's oftentimes in the primary stage, individuals don't know that they have it because it can mimic and look like other diseases. And again, like I said, ain't nobody know that people still get syphilis, but they do. And then secondly, which is your secondary syphilis, you go into where you'll have a rash. Okay, you can have mucus patches in your mouth, which is some little thick patches that be in your mouth. Your hair can fall out. You have this rash that can appear on your hands and feet, all over your body. Again, if your doctor is not knowledgeable about syphilis or knows how to identify the signs and symptoms of syphilis, what they gonna do? Send you to a dermatologist, give you some cream because they think it's something else. Okay, so and then the crazy thing about these signs and symptoms is that they go away without treatment. Okay, they go away without treatment. So you can just sit up there and think that you're safe because, oh, in a couple of weeks, you'll see that the rash go away, you'll see that the lesion go away. But if you have not received any type of treatment, you still have syphilis. And then that's when you get into your latent stage. Okay, so I know you hear about Al Capone, how he went crazy with syphilis and all that type of stuff. That's true. With syphilis, when you have it and you never get treated for it, it can lead to death. It can lead to serious neurological problems. It can lead to serious injuries with your eyes and things of that sort. So you definitely want to make sure that you're getting tested for syphilis. Syphilis, just like any of our other STIs, is passed through vaginal, anal, or oral sex. And the reason that I'm saying all three of those is because I don't know why some people just think that sex is only vaginal sex. No, all three of them are considered a sex. All right. And then the other thing is that syphilis also can be passed from a mother to her baby. Again, that's why it's important as a pregnant woman, you get tested. It's important if you're having sex while you're pregnant that you are using protection, okay? Because it's very deadly for you. If you get an STI while you're pregnant, it can cause some tremendous infections or damages to your baby, okay? Or just don't have sex at all when you're pregnant. All right, congenital syphilis. I tell my mom and I tell anybody that this is the thing that I hate most about my job. The thing that I hate most about my job, dealing with kids who have been raped or in some type of sexual abuse. And of course, they run across my desk because they have an STI, and then dealing with congenital syphilis. So basically, if you have syphilis in your pregnancy, these babies have some serious consequences. They have serious complications if they don't die. Most of them, you have a stillbirth and the baby don't even make it. But if they do make it, they have serious issues. And the crazy thing about it is that this is preventable. Okay, all you have to do is take a penicillin and it will clear that up. But if you're not getting tested, you don't know that you are potentially harming your unborn baby. Here in Arkansas, I just this week, I had an individual that had syphilis. She ended up delivering early, and now her baby has these serious issues. And then even looking back, trying to figure out, well, what done, what could have done differently, to prevent this, and it was just a lot of ways in which, we failed as the health department with assuring that, this individual. So again, this is very important, that you want to make sure that you're getting tested, for STIs, and that you're making sure, especially if you're pregnant or could potentially get pregnant, that you're getting tested for STIs as well. Okay. All right, trichomoniasis, or we call it that trick. All right, this is a STI as well. It's so crazy because some doctors don't like to tell folks that this is a STI, but it is. I mean, only people that's having sex tend to get tricked. It is a parasite that is passed through vaginal sex. With trichomoniasis, the way that they identify this is when, a woman goes and get her pap smear or get an exam, and they actually can see this parasite under the microscope. The thing is so crazy because men actually cannot get tested for trichomonas. So most oftentimes men know they have it or get treated for it because their partner has it, and then they'll go ahead and treat the male as well. Okay, so some symptoms of this is, again, your itching, your burning, your redness, soreness of your genitals, abnormal discharge, a foul odor, so a fishy smell. I know that's like the common thing where guys like to talk about, these women smell fishy. Yes, trichomonas does cause a fishy smell. So again, if you're having those signs and symptoms, you need to definitely go get tested so that you can receive some antibiotics for this. And again, just like the rest of them, most people will not have symptoms, okay? All right, so all of these STIs can be treated with antibiotics. A simple pill, a simple shot. Well, that ain't no simple shot because that bacillin shot is just a big needle and it looked like glue. I don't see how people be sitting up there keep getting syphilis and coming up here getting that shot because it looked like it hurt. but yeah, so all of those that I just mentioned are treated with just a simple antibiotic that you can take, you know, that's administered by either the health department or given as a prescription. All right, so now we're going to go on to the infections that are not curable. So these don't have a treatment. First one I'm going to start off with is herpes. All right, so you have two different types of herpes. So you do have your HSV1, which is going to be your cold sores. So yes, fever blisters, yes, cold sores are a form of herpes. Okay. And then you have your next form, which is going to be your genital herpes, which is your HSV2. Okay. So the thing is, if you have HSV1 or fever blisters on your mouth and you're giving oral sex to somebody, you can pass herpes to them that way. Okay. So if you see folks with fever blisters, don't have sex with them. I mean, don't, you know what I'm saying? You can still get herpes from a person performing oral sex or vice versa with the person that has herpes. Okay, so with herpes, this one is spread vaginal, oral, and anal sex. And then also what I want to add to this one is that it is spread from skin to skin contact with someone who has the virus. Okay, so this is one, you know, where we talk about condoms and things of this sort. Condoms won't protect you from herpes, especially if those sores are located outside of where you have the condom covered up at. You can still get herpes. Okay. So the symptoms are, you know, blisters on or around your genital, your rectum, or your mouth area. Like I say, it's blisters. It looks just exactly like the cold sore. It's just you have it on your genital areas. One thing that's important to know with herpes is so many people have herpes. Okay, herpes is not even a reportable disease, number one, because it can't kill you. Of course, it'll make you uncomfortable, you know, if you have it, but it's not reportable because it doesn't have any long-term effects like your other STIs. A lot of people spread herpes because they don't know they have it. Most people have no symptoms and they don't have outbreaks. Okay, so you can still get herpes from a person, even though you don't see those physical sores, you don't see, you know, the typical outbreaks and things of that sort. And as I mentioned, herpes is very common. I get so many calls up here, you know, where people trying to say, oh, you know, such and such gave me herpes. What can I do? Well, I mean, we tell you to wrap it up. We tell you to use protection. I mean, that's that. I mean, there's nothing that we can do, you know. So just know that this is one of those STIs that's not curable. They do have medications that can make the outbreaks and symptoms a little bit lesser, and then also, you know, if it'll make it less likely that you pass it to your partner. But as far as a cure, there is no cure for herpes. The second one is one that I definitely want to talk about because this is also a very common STI, HPV, or that's human papillomavirus. All right, so HPV is spread skin to skin contact, vaginal, anal, and oral sex sometimes. We really don't typically see that it's passed via oral sex. It's very common. A lot of people have HPV, don't know they have it because typically it will clear out on its own. However, there are some strands that produce cervical cancer, genital warts, and other cervical cancers that we definitely have to be aware of when it comes to HPV. All right, so roughly 80% of sexually active men or women will get at least one type of HPV at some point in their lives. Okay, so HPV is very, very popular, is very common, and that's why it's important for females, go get your pap smears. When you get your pap smears, that's what they are looking for, to see if you have those abnormal paps, to show that you have HPV. Okay, so you're not just going just to look for, just to see if you got, certain stuff, or if you're pregnant. You're going because this is gonna, if you have HPV, they'll be able to catch it early, because there's no cure for HPV in itself, but there is some treatments that can manage HPV if you get it. So if you have warts, you can get them burned off. If you have cancers, there's a way that you can get those cells, treated, and things of that sort. So women, make sure you get your HPV, and not to leave men out of this, okay? Because for some reason people think that, oh, it's only women that get STIs. Somebody had to give it to them, okay? So keep in mind, again, just because, like I said, that's why I say I don't like to use stats, because you'll see it'll show like, oh, this large percentage of women have chlamydia, have HPV. But again, your data is only as good as what's reported. So if men aren't going to go get tested, how are they going to be reported? If white folks aren't going to go get tested, or they're not getting their information reported, how is it going to show that in your stats? So again, that's why I don't like to use statistics, because it affects everybody, no matter what those statistics say. So I already talked about that. So there's no treatment for the virus itself. And again, your immune system actually clears up HPV on its own. So I want to go ahead and put my disclaimer out here. So the same energy that a lot of us are having for this COVID vaccine, I need y'all to have the same energy for this HPV vaccine. So if you have a young child, please go get your child vaccinated. The vaccine that we have, and it's not like the COVID vaccine, this wasn't no vaccine that they threw together in a year. This is a vaccine that has been tested. They know that it's proven, and it does stop a lot of the strands of HPV, especially those strands that typically cause cervical cancer and warts. So again, if you have a young child, it is highly recommended that you go get your child vaccinated for HPV. I know a lot of people like to think, oh, if I go get my child vaccinated or put them on birth control, that means that it's gonna cause them to start having sex. Again, they're gonna eventually have sex in the future. Okay, so you want to make sure that they're vaccinated, so that they're protected from getting those strands of HPV in the future. When they do get married, or when they do start having sex, go ahead and protect your children now from HPV. Hepatitis. We have 3 different forms of hepatitis. I have all 3 of them on here just to kind of show you the different ones. Hepatitis B is traditionally the one that is a STI. The other ones, like hepatitis A, you get that from like food contamination, fecal matter, and things of that sort, not traditionally sexually transmitted. And then hepatitis C, typically get that from sharing needles and things of that sort. So I want to put that on there as well. But hepatitis B is the one that is sexually transmitted. So you can get that through blood, semen, or other bodily fluids if you have sex with a person who actually have hepatitis B. Hepatitis, again, is one of those incurable STIs. HIV/AIDS. There is a lot of stigma against HIV and AIDS, especially when you get in these small towns. It's everybody want to run around talking about, oh, folks are sick, oh, this and that. This is something that, everyone needs to take seriously, as far as making sure that they're getting tested. And then also, if you have HIV, making sure that you are on medications. A lot of the medications that we have out now today is making it where, number one, you don't transmit the virus to other individuals. 2, you live longer. Okay, so make sure that you're getting tested from HIV. This is not the 1980s where HIV used to be a death sentence. Now you have people living up into the 80s, 90s, 100s with HIV. Look at Magic Johnson. Okay, so HIV, again, like I say, is something that, is talked down about and things of that sort. But again, HIV is affecting our Black community because people are not aware. Okay, people think this is funny, like I say, oh, we have such and such are sick, but this is definitely need to be something that, that we're stressing, that we're going to get tested for, and that you're also talking to your children about. Okay, because when you have an STI, so say for instance, gonorrhea, this makes it easier for you to get HIV. Okay, if you have any STI, it makes you easier to get HIV. Why is that? Okay, so when you have these different infections, that means that your pores are open, and then that makes it easier for the HIV virus to get into your body. Okay, so again, you get all STIs the same. Okay, even though they have a separated STIs and HIV is a STI. Okay, so HIV is the virus that causes AIDS. I know one thing that people like to say is full-blown AIDS. There is no such thing as no full-blown AIDS. Okay, so HIV is the virus that you have that causes AIDS. Okay, so HIV, when we test a person for the HIV virus, this is what you're actually testing for. Again, HIV is spread through unprotected sex with an infected person. So again, that person has to have HIV in order for you to get it. Vaginal, oral, or anal sex, blood-to-blood contact, so sharing needles, things of that sort, exposure during birth. So again, that's why it's important that you get tested for STIs when you're pregnant. And then also, so you will not breastfeed your baby. We have medications now that make it less likely for babies to get HIV. So it's definitely important that you are aware if you have HIV, so you can go ahead and start those medications so you won't pass it on to your baby. But even without medication, there's still a 70% chance that your baby will not have HIV if you do have HIV while you're pregnant. But again, that's why it's important that you're staying on medication so that your viral load is low, and also so that you're not transmitting the virus. And then AIDS. So that is like a late stage of, and I don't even want to say late stage of HIV infection. So pretty much, to have an AIDS diagnosis, you have to have an opportunistic infection. So thrush, pneumonia, well, AIDS-related pneumonia, or some other opportunistic infection, or your viral load have to be high, and your CD4 count, which is your immune cells in your body, they have to drop below 200. Okay, so that's when you get diagnosed as an AIDS case. Okay, so those are not two separate things. Again, like I say, it's not full-blown AIDS. You pretty much, because you've developed those opportunistic infections, they've now put you over into the AIDS category. Okay, so when you have AIDS, you still have HIV. All right. As we know, there is no cure for HIV, but there are medications that can extend your life. So when you have HIV, it's definitely important that you find out early on that you have it so that you can get on the appropriate medication so that you're able to live longer. Again, like I mentioned, there's a plethora of medications that individuals are taking now that's causing them to be able to live longer with HIV. So again, it's not a death sentence like it was back in the 80s when it first came out, when we didn't know anything about it. You can now live, long with HIV. Actually, a person with diabetes, would die quicker than somebody with HIV if we just want to go there. Okay, so a lot of people scared about getting HIV. You need to be worried about not eating right and having diabetes, because diabetes take more people out. Okay. All right. So one of the things that I want to talk about, and the reason that I'm putting this up here is because, especially when we get to the African American community, this is something that, we don't want to talk about, or, something that we don't want to see as a resource, or, oh, I'm not out there like that, I don't feel like I need it, and things of that sort. So PrEP is used as a method of prevention. This is called pre-exposure prophylaxis. So with PrEP, you are taking, it's actually an HIV medication that you're taking that prevents you from getting HIV. Okay, so you do have to get this prescribed by a doctor. You do have to have some tests because everybody's not going to be eligible for PrEP. So if you're having like kidney problems or liver problems, you are not eligible for PrEP. However, if you're not, you can get on PrEP and it will prevent you from getting HIV. Okay, so you have to be HIV negative, of course. You have to be HIV negative. So you are going to get tested. And then as a part of being on PrEP, you do have to get regular testing for HIV, because if you do develop HIV for some whatever reason, you have to immediately get off of PrEP and then get on some other type of medication. So you do have to go through a lot of rigorous testing with PrEP. So some of the risks that we like to associate, and these are higher risk. Again, everybody that's sexually active is at risk for getting an STI, but these are some of the things that we consider as high risk. So having an HIV positive partner. Okay, so if you're in a relationship with somebody that's HIV positive, there is medication that you can be on PrEP, and then your partner can be on HIV medication, and you can actually be in a sexual relationship with somebody that's HIV positive, whether y'all want to believe it or not. It happens all the time, where we have, couples where a person has HIV, the other one just for some reason they didn't get it. The person stays on medication, that person goes on PrEP, and then they never get HIV. So it is possible. A high number of sex partners. Okay, that's just like playing Russian roulette. The more partners you have, the more chances that you're exposing yourself to getting the STI. Okay, but that does not mean just because you got 20 partners that you're gonna get an STI, because if none of them if they don't have an STI, you're not gonna get it. Okay, but as we know, because a lot of people are running around here with symptoms and don't know they have it, it increases because, like I said, you have the more partners you have, the more likely it is somebody may have an STI that will transmit it to you. As I mentioned, having a recent STI, inconsistent condom usage, because we already know people start off using condoms and then they'll stop. They'll get comfortable with this person and they'll stop using condoms. And then, especially when you have, your little cut buddy or whatever, you need to use condoms the entire time, especially if y'all are not in a monogamous relationship. You need to use condoms the entire time. And another thing, and I'm going to go ahead and point this out, and yes, I'm about to go there. Everybody do not need magnums. Okay, so another thing is you need to make sure that the condom fit. If the condom is too big, because you around here trying to, say you wearing magnums and they slip off, you are exposing yourself to HIV. Okay, I get that all the time. Oh, give me some magnum. You don't need no magnums. Make sure that it fits, because it's not going to protect you if it does not fit. Okay, or maybe carry both of them around. If you want to sit up here and make these girls think that your package big, carry both of them. But make sure when you're engaging in sexual activity that the condom fits, because otherwise it's not going to do you any justice, and you might as well just go ahead and take it off. Okay, and then also, for drug users that tend to share needles, they are also at high risk for HIV as well, and it is recommended that they get on PrEP to prevent them from getting HIV. All right. When I tell y'all, I be getting the craziest things about how people be getting STIs, especially when you have these girls that be in denial and then their boyfriends be in there lying like they ain't been stepping out. They'll come up with any excuse as to where they got this STI from. So you cannot get an STI from hugging. Now, kissing, most of the time you can't, but like I said, if you do have like a herpes lesion, you can get it because that is skin-to-skin contact. But typically, like with gonorrhea and chlamydia, you cannot get that from kissing, holding hands, dancing. The one that I hear the most is the toilet. Oh my God, like them one good. Yeah, I think I got this from sitting on the toilet. First of all, you ain't fooling me. You are not fooling me at all, because in order to get an STI, as I mentioned, you had to get it from somebody who you were having some type of sex with. You ain't fooling me at all. Sharing lip gloss, massages, even though some of them massages may lead into you having sex, but not massages in itself, don't, you can't get an STI from that. Sharing eating utensils. So I know a lot of people, and again, you have that stigma with HIV. Oh, they got HIV. I can't drink after them. I can't eat after them, or we can't share forks, or we can't. You cannot get HIV like that. If that was the case, everybody around here have HIV. Okay, because there's a lot of people that have HIV that you don't know have HIV. And like I tell folks, people be so concerned about, oh, this person have HIV, this person, having HIV. The ones that got HIV, they on medications. The ones you need to be concerned about is the ones that don't know they got HIV. Because that's how most people are getting infected. Because again, oh, they ain't got nothing. They ain't got this. Oh, they don't look like they sick. How you know? Unless you don't went and got tested with that person, you don't know what that person got. Okay, so of course, like I said, if you knew they had HIV, you ain't gonna, have sex with them unprotected if you do choose to have sex. Okay, but then you sit up here and don't know the status of the other person, you're gonna just do whatever. So treat everybody like they got HIV if that's the case. Okay, make sure you're using condoms with everybody because you don't know what people have. And so to talk about the reducing the risk of STIs. So again, abstinence is going to be the first one on the list. I know, we like to preach about abstinence, and yeah, it's the only 100% sure way that you're not going to get an STI. So yeah, I'm going to throw that up there, just because, that is correct. But we know most people ain't practicing no abstinence. We already know that. So and the second one is no genital contact. Okay, so I know some people think, oh, well, we can have oral sex and all this other type of stuff, and we ain't gonna, yes, you can. You can get STIs from having oral sex and things of that sort. And then, as I mentioned, some of them are spread by touch, herpes. So again, if you're touching on those sores and then you're touching on your mouth, you're touching on your genital area, you can get herpes that way. All right, and third, mutual monogamy between non-infected partners. Okay, and I stress non-infected partners because, like I tell folks, it takes 3 to get an STD. Okay, so if both of y'all, so let's say both of y'all don't have an STI, y'all went and got tested and things of this sort, and then somebody popped up with an STI, that means somebody done slipped out or slipped up, whatever you want to say. Okay, so it takes 3 to get an STI. Okay, so if you don't have an STI, that person don't have an STI, you can have unprotected sex if you want to, you can share needles if you want to, because you're not at risk for getting an STI because you don't have it. Okay, and like I just mentioned, you can't get it from a toilet seat. You can only get these from sexual exposure. All right, so protected sex. So I know I mentioned that condoms don't work for like herpes, especially if those sores are outside, but it's better to use them than not. Okay, so it's not 100% guaranteed that you can't get an STI, but for the most part, if you use protection correct and consistently, and like I say, correct, because I told y'all about the magnums, I told them just gets on my nerves. You have to make sure that you're using those condoms correctly and consistently all the time in order to reduce your risk for STIs. Fewer sexual partners, regular testing. All right, so this is very, very, very important that you go get tested before you are having any type of sexual exposure with anybody. Okay, just this week, I just had it where this woman, she had HIV. She didn't tell her husband that she had it. Okay, but the thing is, if they would have went and got tested in the beginning, they would have both knew their status. Okay, so that's the only sure way to know the status of your partner is if you go get tested together. Don't use them tests that they went and took 3 months ago. Okay, because they could have had sex after that and they could have contracted a STI. Even with HIV has an incubation period, meaning that it can show up later on. Okay, so your test might be negative, but that means that, you just haven't built up the antibodies in order for it to show on a test yet. Okay, so I be seeing people posting on Facebook all the time, they test results and all this other stuff. That don't mean nothing. That means you just you're negative at that point of time. You still need to go and get tested then with your partner in order to reduce your risk of STIs. No sharing of needles, okay, because needles have blood in them. Blood, again, that can give you HIV, hepatitis, and things of that sort. And then PrEP. As I mentioned, PrEP is an effective way to reduce your risk of STIs. Again, if you are having sex, and I'm gonna say this again, if you are having sex, you are at risk for an STI. Again, STIs do not discriminate, and anybody can get an STI if they are having sex. That includes oral sex, okay? So if you're not having sex at all, you're not at risk of getting an STI. But if you are having sex, just know that you are at risk for getting an STI. All right, so I'll leave y'all with this. Talk to your kids about sex, okay? I know a lot of people, especially people in our Black communities, do not want to talk to their kids about sex, but it's very important. And the reason that I say that is important is because, yeah, they might not engage in sex right then, but they eventually are going to engage in sexual activity if they aren't already. You don't know what your kids doing every day. We all know we all snuck out and did stuff. So it's better for your kids to know the information when they are about to have sex than not know the information, and they either end up getting pregnant or they ended up getting a STD, especially one that's not curable like HIV and herpes. So it's very important that you teach your kids about sex, because if you don't teach them, they're gonna go and get this information from somebody else and it's not gonna be correct. They're gonna get on the internet and find some misinformation and it's not correct. If you don't know about STIs or you don't feel comfortable talking about sex to your kids, call me. I'll talk to your child all day about sex. Because I know you got some daddies that don't want to believe that they little baby girl out here having sex, but it is very important that you talk to your kids about sex, because you can save them a lifelong of having to deal with these consequences of getting an STD. Okay, STIs do not discriminate. If you having sex, you can get an STI. And I'm gonna put my plug out there again for this HPV, because this is not utilized a lot, because it's almost like birth control. People feel as though, if I go get my kids vaccinated, that's gonna start them to having sex. This is gonna prevent your child from getting those strands of HPV in the future when they do have sex. So make sure that you get your kids vaccinated for HPV. It takes 3 to get an STD. So if you got an STD and if you know that you're not having sex with anybody, that means that the person that you're having sex with is having sex with somebody. Okay, so you just can't get it out the air. I done heard that too. One guy said he was washing clothes and he asked me, can he get a STI that way? No, you cannot get HIV or anything that way. But just know it takes 3 to get an STD, or 4 or 5 or 6 or whatever. And then get tested on the regular. The only sure way that you're going to know if you've been exposed, if you have an STI, if you've been infected or anything, is to get tested. If you don't know, you can't do anything about it. Okay, if you find out you have a chlamydia, the world is not going to come falling down on you. The world is not going to end because you have an STI. There is treatment for that. Okay, and then also you want to get tested because you don't want to spread it to others. Okay, so I know some people act like they don't want to get tested and all this other stuff, but it's very important that you get tested, because even like with HIV, you definitely want to get tested early or find out early on if you have HIV, is so that you can make sure that you're on the appropriate medications. They even sell HIV tests in Walgreens. Okay, they sell them at Walmart. They about $50, but at least you'll know your status. Okay, so there's multiple ways that you can go to get tested. You can go get tested at a health department. You can go get tested at your private doctor. You can go get tested, like I say, you can go to Walgreens, get those tests. They even got tests now where you can get testing done over the mail, in the mail, where you do your samples and you can send it off and you can get tested. So there's plenty of ways where you can actually go get tested for STIs. And again, it's very important that you get tested before you engage in any type of sexual activity. Okay. And that's all I have.
Brandi, Brandi, that was very good. Thank you. Thank you so much. What a great presentation. Um, I do have a few questions here, but I do want to tell people Brandy's going to come back tomorrow night. I am going to ask the questions that was put down in the comments so that
Okay.
she can respond to those. But I do want you, if you have any additional questions, please put them in the comments. You can send it to me, Facebook Messenger. You can send it to Brandy. You can send it anonymously if you would not like to be identified with any questions that you have. Listen, this information, it may not have been a comfortable conversation, but it is a much needed conversation that is needed within our community because you keep turning your head as if it's not going on, but that's not the truth. The truth of the matter is these things are going on, and the information is put out there not to make anyone feel bad, not to make anyone feel embarrassed. And so, whatever you need in there, just pick it out and use it, or
Mm-hmm.
ask the questions that you need to get some things taken care of. You can do some things privately. You can do some things anonymously. You can do some things where no one have to know your business. As long as
Mm-hmm.
you, there's three things that I got out of that. Number one is be informed. Please, please, ma'am, please, sir, be informed. And number two is know your status. Know your status. And number
Yes.
three, it takes three. Now that stood out to me because y'all, I know. I mean, listen, I'm ready to go to battle. I stand on what I believe, and I believe in this wholeheartedly. It takes three, ladies. It takes three. Um, know your status and then be informed about these things. So, Brandy, I'm going to ask the three questions. Tina says very knowledgeable and informational. Brandy, good job. Necessary. Oh, thank you, Trina. Inspirational. Oh, wow. Thank y'all. Thank y'all. Y'all. Yeah.
Thank you.
I know I wasn't representing it. It was Brandy, but listen, but I a nice comment. So I appreciate it.
Thank you.
So one of the questions was, Brandy, from somebody in the comments. They say, does the other STIs have the fishy smell? I know we said, I know you said.
Yeah. Yeah. So to answer that, and I left that out on purpose, and I should have put that in there. So you do have other infections. One in particular is bacterial vaginosis, also known as BV. And then I know that's an infection that a lot of women get, and it does have a fishy smell as well. So you definitely want to go get tested to make sure that it's not trichomonas. Okay. So there is another STI that, like I say, an infection that's actually not an STI that can give you that fishy smell, but you ain't gonna know until you go get tested for it. And again, the test will be able to show, the parasite that's in trich and differentiate that from BV. And then you also have yeast infections. Those are not sexually transmitted as well, which is why I did not mention those. Good question.
Okay. So I'm sure you're on the line. You heard that. Question number two was, what is the age for children to get the human papillomavirus shot? The age.
Yeah, yes, and I have to look it up because it seemed like they changed the age, but I think it's 11 and 12. But I can get that information, but I believe it's 11 and 12 that they recommend that you get your child vaccinated.
I think I'll just go a step further because I remember working in child welfare. We had to make sure our children got that shot, and I
Hmm.
say it was no later than the age of 13. So I will say anywhere
Right.
between 11 to 13 that the
Hmm.
HPV shot will be taken. I will even include on that for parents, pay attention to your children's shot record. Because all of your children, when they get their last shot, some of them they don't have another shot until I want to say it's 12. I want to say that age is 12 until they get
Hmm.
to be 12 years old. And so it would have the age that the child needs to take their next shot. I want to say it's right before they go into high school that they have
Hmm.
to have that HPV shot. And so Please pay attention to your children when you're taking your children to be vaccinated. It's very important that your children
Mhm.
are being vaccinated, as Brandy has, stated to us for to deter some of the other things that they may incur as they get older. Now, here's the thing that we don't want to talk about, but we'll talk about it a little bit more on tomorrow night, is because some of our children are being abused and molested. The month of April is also the month of child abuse. I specifically and intentionally did this because some of our children are contracting some things innocently from some people who are mishandling them and abusing them. So, see,
Mhm.
for every reason you tell me we don't need to talk about this, I can give you another reason of why we do need to talk about this. That's why we need to pay attention to our children's shot, because having them their shots on time could, prevent them from contracting something, or, taking on something that was not even meant for them in their innocence.
And
Okay.
Miss Jakita, I want to add something to that. And I know I didn't talk about this, but and I'm glad you said that, because that's very important that you teach your child sexual health early on. Teach your kids about good touch, bad touch. I know, especially Black folks, they like to name pocketbooks and pooches and all these other different names, but your kids need to know the real terminology and know that it's not appropriate for individuals to be touching their private areas. So sexual health is something that you need to start early on. So if someone is doing things misappropriately, inappropriately to your children, that they can be able to tell you, that they touched this spot, and that they know that, hey, those spots are off limit. So you definitely need to start early with teaching your kids about sexual health.
Thanks, Brandy. And if you don't teach your children sexual health, somebody
Mhm.
else is going to touch your child and tell your child not to say anything about it.
Right.
So your
That is
child
correct.
winds up keeping it a secret for 15, 20, and 30 years. Ask me. I can testify to any of that. So what Brandy is talking about, it has so much truth, it has so much validity within what she's speaking about. And she's so passionate about what she does. She's so informative. She knows what she's talking about. And she broke it down in terms that anybody can understand the information that was presented. So I will say that this is recorded on my Facebook page, on her Facebook page, and by all means, I will upload this to YouTube. Subscribe to my YouTube page, just Jakita Williams. Go to my YouTube page, Jakita Williams, and maybe there's a friend that you might need to send the link, whether it be Facebook Messenger or whether it be YouTube. But get the information to the people who need it the most. This has nothing to do with being embarrassed. This has
Mhm.
everything to do with people wanting to live and live a life that is free from some of these things that are holding people in bondage. And you don't have to feel shame. Let's remove the stigma. Because any one of us, if we're engaging in unhealthy sexual practices, we can be recipients of any one of these things that have been mentioned. So let's remove the stigma. This is
Mhm.
not about you. This is not about embarrassment. This is about each and every one of us who will practice unhealthy sexual practices. And so, question number three, Brandy, is the last one that I'm going to answer tonight. And any other questions, y'all please come back, proud mom. y'all Y'all come back tomorrow night, and Brandy's going to be back with us again.
Mhm.
And that's where I do Let's Talk Life. So we're really going to talk it up. We're really going to answer some questions. And I will say this, when you ask Brandy a question, be ready for the answers, because she's not going to cut any
Yes,
corners.
ma'am.
Like I cut corners. I cut corners sometimes. I cut corners. I try to get the point across. But if you ask her a question and you really want to know, Brandy's not going to cut any corners, and she's going to give you the answer that you need. So, therefore, if you want to send it to us anonymously, we will not mention any names. We will just ask the question, and then Brandy will give an answer to the
Mhm.
question. So, Renetta said, please be ready as her cousin. Okay, you going to be ready? Okay.
My family will tell you. They know I brought a suitcase home full of Trojan condoms, and I sure passed them out.
Next time you come home, please drop me off some
I
too.
sure will.
I'm in the community talking to people, and I want to,
Mhm.
you know,
Most definitely.
one of the things is I want to be able to help within our community with certain things. And if I'm not the one who's the educated one, at least I can be connected to someone who's educated that I can, I can steer them to, or I can provide. The least thing I can provide in that area is some condoms. While I'm passing out food and all that kind of stuff, y'all might get some condoms.
That's
That offends Christians. But before I go one step further, if I have offended anyone who's saved by grace on tonight, I apologize in advance. But many of you have some cheating husbands and you have some cheating spouses who are going out there contracting some things and bringing it back to the person who's innocent and not bothering with nobody. So no one wants to talk about that. Okay. And so therefore, while we're in the church, we're committing adultery, we're committing incest, we're abusing children. We don't want to talk about that. And women are being highly affected by these things that Brandi is talking about. Why? Because you're married to somebody or connected to somebody or supposed to be in a monogamous relationship when it turns into be a polygamy relationship. Y'all ain't hearing me tonight. I'm not gonna
they
preach.
sure not. They not hearing you.
I
They're
am
not hearing you.
everybody, y'all. I am.
Yeah, and you're absolutely correct. Again, I have had to tell so many women that they are HIV positive. Okay. And I never knew, I never suspected, I never get tested. So again, just because you're married, don't use it as an excuse that you're not going to get, tested and things of that sort. Because like I say, it's real. These cases come across my desk every single day. And I know I'm here in Arkansas, but the cases are just in Florida as well, everywhere. Just Google CDC and go to STD statistics, and you will see this information is real. And actually, when you look at those statistics, like I mentioned, that's only a drop in the bucket. It's a lot of cases that don't even get reported. Okay, so it's actually more than that. So again, be aware, be informed. If something don't look right, like I tell my kids, if something don't look right, run. If it don't look right, run. Don't be scared to look. Don't be scared to ask questions, because that's the other thing. Women don't like to ask questions. It is nothing wrong with you telling the guy to put on a condom. It is nothing wrong with you telling them to go get tested. It's nothing wrong with you telling them no, that you don't want to engage in these type of behaviors. Okay, you have the right as an individual, and even for men as well, because you have women who pressure men into having sex as well. So again, you have to hold yourself accountable, okay, for the actions that you choose, and just know your actions can lead to long-term consequences.
Absolutely, very well said. And me and Brandi keep talking, y'all. I promise this is the last one. This is the last one. And I got one more question. This is the last one.
Okay.
You need to know that someone is not going to tell you about their status. And so you're going to have to take ownership and responsibility of yourself.
Exactly.
Everybody's not going to tell you they're infected with something. And the question that we always ask, why didn't you tell me?
Mm-hmm.
They're not going to tell you. So you need to take responsibility of the only variable that you're control of. They have female condoms as well that
They
you
do.
can wear to protect yourself. Okay.
Mm-hmm.
Okay. Now the last question, Brandi, for tonight
Okay.
is crabs a STI? I'm just
Yes. That's a good question. So that is one of those ones that I left off because yes, it is sexually transmitted. The ones that I talked about is just most of the common ones, but yes, crabs is called scabies, and it's little bugs that is in your pubic area that can be transmitted sexually. So yes, scabies. I haven't seen those a lot, and of course, and I'm not a medical provider as well. I'm not a doctor, so any of this information, you're more than welcome to go talk to your doctor as well, to ask them more clinical questions. But yes, scabies is an STI. I just didn't touch on that because it's not as common as the others. And again, that's not one that's life-threatening, that can cause long-term consequences, like chlamydia and gonorrhea and syphilis.
okay. So I hope that you have enjoyed, Brandi. I have really enjoyed this on tonight. It is some very good information, and I hope that the people who can benefit from this information, that they will take it and they will utilize it. And so you're going to have one more shot with Brandi, and Brandi's going to be here on tomorrow night at 7 p.m. And she's here. She's going to give a brief overview. We're going to start out with a brief overview, and then we're going to go into asking questions, because tonight was not kind of, I wanted her to present the information. I wanted her to put it out there, lay it out there. Like I say, if any of you are delayed cognitively a little bit like I am, I have to read it again and again before I can, go ahead and sit down with my questions. And so just because we have letters behind our names doesn't mean that we need a minute. And so if you have enjoyed Brandi, please by all means put hearts in the comments. Let her know that you really appreciate her time, her consistency, and being very informative. She's very professional. I seen her present. I think it was in Washington or something like that.
Yes, at a STD conference, I did get the opportunity to present about health equity in our Black
Yes,
community.
yes.
Hmm.
I thought that was very, and that's when I got the interest. I was like, man, I would like to, get an opportunity where we can present something to the people, like it or not. I'm not going to be held, but now you're not held accountable for not knowing, because once
Right.
the information out there, then you're held accountable that you had the opportunity, that the information was presented to you, but you ignored it and you didn't want to accept the information. Now, I don't have anything to do with that. My job is just to put it out. I don't
Right.
care what your title is. I don't care who you are. I don't care where you are, because this thing, no one is exempt from this, and it
Mhm.
is floating around as if it is the thing to do, and it's not the thing to do. That we've got to take back our health. We've got to take back the safety and the endurance of our livelihood and our life. So this is going to be the end of our presentation for tonight, and Brandi is going to come back with us on tomorrow night. So if you know somebody who wasn't here on tonight, go ahead and bring them back tomorrow night and let them tune in. Okay. So thank you so much, Brandi. I'll see you on tomorrow night here at Universal Truth Ministries. I love you and God bless you is my prayer.